Zara, thank you so much for joining us today for a Corona conversation. For people who don't know you, do you just want to tell people what you do and where you are in the world?
Sure. So my name is Zara, as you said, and I have an organization here in Mexico. It's called Instituto RIA, RIA, and we do drug policy research, and we also do a lot of drug policy advocacy work. So we've really accompanied all the legislative processes that are going on, primarily right now around the regulation of cannabis, but we also work on other substances, and we believe in the regulation of all substances. And we are happy to collaborate with the Global Drug Survey to implement the survey every year here in Mexico. And I collaborate with Acción Técnica Social in Colombia. So we've done a lot of work on cocaine and also the Global Drug Survey there. So yeah, but my main work is here in Mexico right now.
And I guess that's why I wanted to talk to you, because I think when people think about Mexico, they don't think about the lived experience of people who use drugs within Mexico. They just think of the shitstorm of the war on drugs, death, destruction, undermining of democracy, and how bad it is for the rest of the world. What I want to talk to you about is how's coronavirus impacted on the drug using community in Mexico, and what's the government doing? What's happening?
Well, I would say right now, Mexico is about 2 to 3 weeks behind Europe in how this epidemic or pandemic is kind of playing out. And so just to put it in perspective, we're speaking today on Wednesday, March 25th, and we have 405 cases, confirmed cases. We've had 5 deaths, and we've had 7 cases that the people don't know who they were infected by. So like local contagion, as they're calling it. But the government has put into place, really it's each state that is determining. So it's also important to say we're a country of 130 million people. So it's quite a large country. We have huge geographic space. And so each state is putting into place different restrictions. And obviously in Mexico City, it's the most restrictive because we have the highest number of cases, or we're at the top of the number of cases. But thus far, we're not on lockdown. We're not having trouble having access to substances. But the government, I could say 100% is not focused on people who use drugs as a key population that they need to be worried about. In the states where there is more of injecting drug use, there's not a lockdown in place, so people are able to go to the services that they normally use. But this will probably change in the next couple of weeks. And so really we're also looking to our colleagues that are already going through this to know, okay, what are the measures that we can put into place to kind of support that. Now, we've also had lots of information come out about how do you take care of yourself? What are the harm reduction tips that you might need to, you might want to begin implementing as we begin this process, no? And being a couple of weeks behind Europe really helps us, because if this had started in Mexico, we don't have a strong health system. It would have been completely collapsed. So really what they're trying to do, and what the government has been telling us as a society, is they're hoping to slow the spread of infection. So it will be a much longer time frame for us. They today said until August. So they're trying to slow the spread so that the health system will be able to deal with the cases that come up, but that it will be much longer. And so obviously the concern is people are going to get tired of being confined or quarantined or in self-isolation or at the safe distance or whatever term we want to use. And so we need to make sure that there are things that are happening that will allow people to. So I think this type of thing, like a Corona conversation or a COVID conversation, is important because it gives folks are looking for content to help us get through this. And so but early on, there were already harm reduction measures that we were telling people to take. So it was stop sharing your joint, just as simple as that. If the last action that we did, kind of public action that we did here in Mexico City, was on March 15th, which celebrated or commemorated 100 years of cannabis prohibition here in the country. So it happened in 1920. And already there it was, bring your own pipe, and already with ground flour that you're going to put in it. Don't share your pipe. If you already, just those normal things. And And so because that has been, that's the main thing. Here in Mexico, we smoke joints. So people share them all the time.
So it sounds like, as in other countries, it's the community of people who use drugs are actually starting to implement smart strategies before the government has got its head round about what needs to be done.
100%, yeah.
Well, one of the things you said that I was really interested in is at the moment there doesn't seem to be any shortage of drugs. Now, is it likely that Mexico, both as a, you know, a conduit country for both heroin and coke, are you realistically actually gonna get a problem where there aren't enough illicit drugs in your country? Or is it going to be a case that actually dealers are going to want to get as much out of the country as possible because that's where the bigger profit is? So in fact, you guys do suffer.
Yeah, I mean, so right now, Mexico, we cultivate and produce primarily cannabis, poppy for heroin production, although fentanyl has obviously had a huge impact on our poppy production, and meth. We produce a lot of meth. So where we're going to see a shift is precursors coming from Asia in order to make meth and produce it, which then mainly is exported to the United States, but we do have local consumption happening. And so that's where we might see a shift in consumption patterns. But since we produce cannabis, there will be cannabis. And I think the hard part will be when they start being very strict on leaving the house or being able to move around, which maybe we won't get to that point because of the lessons learned from other countries. So right now, for example, if you want to buy drugs, and most of the people I know who distribute drugs are trying to get product out the door because they're worried about what's going to happen and that they're not going to have money for their families. So everyone I know who's working in this business is trying to think about how are we going to take care of our loved ones economically over the next couple of months.
Is the risk, therefore, that people are inadvertently going to end up stockpiling because, you know, suppliers are putting out special deals because they want to get some bulk purchases? And then my worry is that maybe someone who would only normally be found with a gram or two suddenly gets found with half an ounce and they get done for dealing. Or someone says, oh, I'm going to buy my half ounce, but that's going to last me for 3 weeks. But, you know, like the cookie jar, it's like that doesn't happen. So yeah, people, you know, get feast and famine.
Well, there's been so many memes online, of like in day 3 of the quarantine and you've already used up all your drugs. And so what do you do? And that's where we might see an impact on markets. Obviously, as harm reduction tip, also, we've been telling people, you know, maybe don't consume MDMA because it can lower your immune system, and also because it can motivate you to take risks in sharing bodily fluids with people. So that might have an impact.
No, hugging.
I mean, just touching each other, you know, like in any way. We have some cocaine use, which obviously cocaine is going to be, that I think is going to impact much more Europe, because the cocaine's not going to be leaving Colombia to get there. Because we also have to think, like, all of the people who are engaged in this business, it's like stewardesses on flights, it's people who are on cargo boats, it's all these activities that now are going to shut down greatly. And so it's kind of like we're going to have this stockpiling, and at the same time, we probably, here in Mexico, we will probably be okay. There is some consumption of heroin, and which has been adulterated with fentanyl on the border, and but that will continue to be the same problem as before, in that these are adulterated. And what we've heard is that really it's going to be that we're not going to be getting precursors from China for these synthetic drugs. And that's where we might then see new substances coming onto the market, which then obviously the hard part is going to be like, how are we even going to be identifying new substances? Because there's not going to be drug checking that's happening. And there's certainly not going to, like, I don't think the government is going to have the capacity to really even begin to think about that piece of this larger puzzle. And so one of the things that we would hope, and that maybe if we continue to see people being detained for carrying drugs, is that, and we've been trying to work with the city government on this, Mexico City government, of like, how do you reduce drug crimes to zero priority? And particularly in a state of emergency, maybe we will need to go to this and try to push them to just make a decree of some sort where they can't be, because in Mexico, the amount that you're allowed to carry is 5 grams. Nobody buys 5 grams. People buy 28 grams because you do want to have enough, and because that's just the quantity that normally people buy. So we have lots of arbitrary detentions that happen here in Mexico, and the two scenarios that usually happen when you're stopped by a police officer and you might be carrying some drugs is, one, they try and get money from you, so then you don't ever go through some sort of judicial process. That's if you have the resources to pay that money. Or number two, if you have below the amount that's permitted, which for example with cocaine is a 0.5 gram of cocaine, then they oftentimes will threaten to plant other substances on you in order to carry forward a judicial process. And most people who are carrying around substances probably have more than the 5 grams or more than the 0.5 gram. I was accompanying a case a couple of weeks ago where the person had 18 grams of cannabis on them. But at the end, when they appeared before a judge, it was actually, they said it was an illegal detention. And so the man was allowed to go free, but he still had to pass, 3 days in jail. His parents his family had to pay for a lawyer. So these are the sorts of things where we're going to see shifts. Now, another factor that I haven't said yet is that actually the entire judicial branch has shut down for a month. So they won't even be taking cases. So that's going to be a big question too, of like, if you can't, does that mean that when you arrest somebody, they have to stay in prison or they have to stay in jail, some sort of holding for that entire month until they're processed? Or are they just being very specific on what kinds of crimes they are investigating and putting people in jail for?
I mean, Steve said exactly the same thing. And I think the whole idea that police are going to have other things to do and effectively de facto giving everyone a break, but actually explicitly saying that to the population, because what we don't want is the fear of law enforcement being there as a barrier to people seeking treatment. So, right.
Well, and that's a hard part because so many police officers get supplemental income from extorting people, including people who use drugs. So that's going to be like that's going to affect their families.
There's so many bizarre downstream consequences of this that,
yes.
And I guess that's why we're having these conversations, because it's just overwhelming about, I was on a telephone call with a sex worker group and they were like going, we don't have any business. Like, yeah. What are we going to do?
It's a huge issue. I mean, and that's one of the things that in Mexico, they haven't wanted to shut down things because of the economic factor, because almost 60% of the population works in informal economy, which means that you have to go out to get paid. You can't stay at home. And so the message has been, if you can stay at home, understanding that there are lots of people who are going to have to go out. But the person who sells candy outside of the metro, no one's going to be buying their candy. So this is going to have huge impacts that I think we're still not beginning to register. And for us, obviously, we believe that we should be safe before we worry about those. But then people are coming together, for example, 5 people, we're each going to donate a certain amount weekly and know that then you can kind of pay the salary of someone who is in a precarious economic situation. There was something I was going to say and now I forgot. Well, and I guess we're just going to see how this keeps going. One of the things, we had a strategy call yesterday on regulating cannabis and kind of what's going to be our virtual advocacy strategy now that we can't go visit the senators. And, one of our key arguments has to be that after this, we're going to have to reactivate the economy, and regulating the cannabis market is going to be an excellent way to do that. And so it's also about figuring out how you can use this to really strengthen the arguments and the interventions that we've been asking for. I know that they've been expanding OST and take-home doses in other countries. And so I think those are, how do we use this to really demonstrate that that people who use drugs are a key population, a huge population that need certain services. But at the end of the day, and we heard this from some colleagues in Spain this morning, we need safe supply. We need legally regulated markets.
I think you're right. It's going to be the economic argument at the end of the day that's going to probably drive a lot of these changes. The police have got other things to do. There's more money to be made selling drugs than trying to enforce them. And this is also a time where the world has to just be honest. Like, you can't start, you can't continue patronizing and punishing a group, particularly now, because there's probably never been a time when it's been more important to try and have a healthy group of people who are using drugs. Because, they're already, you mentioned MDMA suppressing your immune system. I'd be much more worried about heavy drinkers and people who smoke anything. And you don't want those groups clogging up the hospital. You want to do everything you can to keep them happy. And, you know, I'm hoping that we will be able to ramp up low threshold opioid substitution systems, you know, cut through some of the red tape, make it easy, make treatment fit in with people's lives, as opposed to getting patients to fit in with clinic hours, because that's what suits us.
Yeah, and recognizing that abstinence is not going to be the only way. And so how do you kind of take care of people during this time? I was talking to a friend in Colorado yesterday, and she said, you know, the governor, it's the mayor of Denver, shut down for about 3 hours all alcohol stores. And then he realized, oh no, we can't actually do that. We need to allow people to have access to alcohol. And the same thing has happened with the cannabis businesses in different states. You know, these are now considered, in Canada, it's considered an essential business. And because if you are in your home, you need to be able to relax. I mean, one of the things that's been coming out a lot here in Mexico too is because on the 8th of March, you know, before this really went into full swing, we had the largest women's march that we've ever had in Mexico. There were, you know, the estimate is 250,000 people in the streets, women in the streets. On the 9th of March, we had a women's strike where women just didn't go out. And it was eerie, you know, if you saw the pictures of classrooms without girls and the streets without women. And so one of the things we've been bringing up is you also have to be careful because violence is still happening against folks. And so how do you protect people when you're telling them to stay in their house and their house might not be a safe place? And so there's a lot of, I feel like out of this is going to emerge all these different networks and virtual ways of support. And we're going to have to figure out how we deal with folks who are in tough positions and who can't really be staying home safely. And so then how do we find safety nets for them? And that's what it's showing as society. What are the safety nets we have in place? And unfortunately, most of the time we don't have very strong ones.
I mean, you mentioned the issues of domestic violence, and I think I also have concern for all of those kids. And if your schools get closed down, who are now going to be at home with maybe parents who are drug or alcohol affected, or simply don't have the emotional capacity to manage with those kids.
To manage 24 hours with children.
Oh, yeah, listen, tell me about it. I mean, I think rape and infanticide are going to go through the roof, and divorce as well. In which case you're thinking drink and drugs could be a way of getting you through, but not if you're responsible for your kids. So it's trying to find that balance. And, you know, kids who were the only square meal they were getting at home, you know, was at school, and now they're at home. So there are so many potential ramifications. And I guess, it's the point of these conversations is to try and learn where there's really good examples of practice. But so far, everything I've heard is the drug using community knows how to look after itself, and it can generate really smart suggestions for policy that cost governments nothing, but actually might have huge benefits both economically and for the health and well-being of everybody.
Yeah, I think this is the challenge to us as a society. And I think as drug policy reformers and people who use drugs, we have always known that the state is not our key ally in this, or has not been historically. And so how do we come up with solutions that work for us? And that's just like the basic harm reduction thing of meeting people where they're at. And where we're at right now is that no one's thinking about us. And so we have to figure out, how do we take care of others? And one of the things, you know, that's going to be hard is that a lot of folks don't have the resources to stockpile for a month's worth of what they're using. And so, I mean, we have to think about, how do you identify those folks so that they can have some of the support they might need. Obviously in Mexico, our goal and our hope within dealing with this, both as society and as government, is that we never get to the point where you can't get in your car and drive somewhere. You know, that sort of lockdown, but rather that people will continue to move, but that people need to stay in their homes, or, you know, like how do you shape that so that someone could still go to their dealer's house or vice versa? I mean, the other thing we've been talking about a lot is like, how do you keep your dealers safe? Because they're the ones moving around to places, and so that there isn't a transaction of cash, but can you do deposits, but then you need to have a bank account. So all of these systems that when we come out of this are going to be put into place de facto, and that might continue, and it's going to change the way the drug markets work, I think. I mean, possibly, you know, deep web sales are going to go through the roof, because that will be a more easy and safe way to get substances.
So yeah, I mean, I think darknet's an obvious place for people to go, but then we'd worry about the increase of synthetic analogs, fentanyl, and I guess I worry about people displacing to prescription medications or other depressant drugs that they're maybe less familiar with. And then there's all the risks of poly-CNS depressant use, benzos, opiates, pregabalin, and then people not using with other people, so they're using on their own, so they're at greater risk of overdose.
Risk for overdose, yeah. I mean, it's going to be I can definitely connect you with some folks in Canada, because I feel like that's one of the big concerns there, because they are in the middle of an overdose crisis that has been going on for many, many months. And these are folks who are in high situations of vulnerability. I mean, here in Mexico, it's about 150,000 people who inject drugs approximately in the country. And it's very specific cities that have that issue. Whereas, in Mexico City, they estimate that it's less than 100 people that inject drugs. And most of the time they're injecting stimulants. So it really depends on the substances we're talking about, the group, and how much of a, for us, it's like, so do you shut down treatment centers? Once we get to that point, will we just shut down treatment centers? How do you shelter folks? I mean, then there's a whole conversation that's beginning to be discussed around people who are currently incarcerated and who are experiencing them withdrawals because there are no more visits that are allowed to go in. So no substances are getting in, but at the same time, they're at a higher risk of contracting COVID-19 because they're in these overcrowded spaces. And so there's some states like New Jersey in the United States, and in Mexico, we haven't started to have this conversation yet, but that are now excarcerating or letting people out for probation violations. So that means that you just didn't show up to a meeting when you were supposed to, so they put you in jail for 3 months, or for sentences that didn't include prison time to begin with, but that you just didn't follow through on one of the requirements that they put before you. So really, this is beginning to detonate a conversation around criminal justice reform and how people are living, right? How people are living in jails, in treatment centers, and in these close spaces.
So it's bizarre. It's going to be the world's war on coronavirus is going to make them wake up to the futility of the war on drugs. And maybe
I hope so. Only if we do our work, only if we do our job and we bring it up.
Yeah.
And we make those connections.
The other lovely thing that you said, and I mean, I doubt Donald Trump will watch this, is that I'm sure Donald Trump would have loved to have pointed to the Mexican border, where clearly all evil in the US comes from. Exactly. I love the fact that you've got virtually no cases, but thanks to his unbelievable absence of leadership and intelligence, the US is going to get hammered in a way that it didn't have.
The US has 50,000 cases right now. I mean, we have, and we might have more that have not been diagnosed, because we have 405, and then we have about 800 that are suspected, but they haven't gotten the results back yet, or that they're still in the process of doing it. But yeah, I mean, at this point, we should be closing our borders with the United States, not vice versa.
I love that as a pronouncement from the Mexican president saying to Trump, we don't want the Americans in. Yeah. I love that idea.
And we don't, I mean, when you see the difference, and I completely agree, there's been a lack of leadership in the United States. In Mexico too, our president has been very irresponsible in his behavior towards people. He shakes people's hands, he kisses them, he gets very, very close, like he doesn't understand how to keep a safe distance. But I think that the people in charge in the health ministry are very smart. They're technically very prepared. And that's who's really leading the charge on this. And so every night at 7 p.m., there's a briefing by the subsecretary of health, and he provides everything, all the information we need. And then the president comes in every morning and he kind of rambles and does his thing. But it's a clear contrast between someone who actually knows what they're talking about and then someone who's just who's a politician.
Yeah, I mean, there are some politicians who know what they're talking about. It's just, anyway, I can't mention his name again. So I'm going to say thank you so much for taking the time. So my last question for you, and it's what I ask everyone I interview, is in the next week or so, could you go and find someone to interview who you think has got a story to tell anywhere in the world, whether they're involved in policy, whether it's someone who's living through this, because I really want to make sure this is a platform for people who are using drugs and they're trying to find a way through. This is a voice for everyone, and hopefully we can all learn. So,
I have to find somebody who can speak in English, so that will be my one barrier. But I'll try and find somebody here in Latin America who can speak to what's happening, because I think this is a region that that has had swift lockdown and shutdown in many countries, because we recognize that we do not have the capacity that Europe has to confront this, and so we need to be a little bit more careful.
I mean, hopefully once Aleksi sorted out how to do this, we think we'll actually be able to do transcripts with subtitles. So actually, doing it in Español is no problem.
Perfecto.
I was going to try and say, "Yo hablas Español," but clearly that would not be true.
No, it's great. I would just say, everybody take care of each other, because this is when you should be checking in on people. And also because, one of the things we didn't mention yet, but you'll probably come up in other conversations, is just our mental health when we are in confinement, and when we are either with one person or two people, or just like in very close quarters with folks. And so we just need to be taking care of ourselves. Make sure that you spend a couple of minutes, either alone if you're always with somebody, or with people and I feel like these kinds of video chats are so important, because we just need to be able to look people in the eye, even though we, because we just need to be taking care of each other. Even this is just be gentle with each other. It's it's like compassion is should be our first reaction, even though it's very hard to have that be it when we're under so much anxiety. Yeah, and if you need to say fuck, then do it under the pillow when that person isn't in the room, and certainly not when your kids are about. Exactly. I think I've sworn more in the last 10 days. My kids are going, they're learning new words again. It's like, oh damn, they're learning new words for sure. Yeah. All right. It's a time to be grateful for what you do have, because most of us who you're probably interviewing also have a lot more privilege and capacity to deal with this than most folks. And so, yeah, I mean, I feel like we're living in the future right now. And I'm not sure how we get what comes after that. Like in August, in September, when we start all gathering together, will we have learned lessons? What will be the reflections we have? So hopefully we can use these conversations to keep having those and see how it goes advancing. And to remind ourselves, you're right. It's difficult lessons, they're the easiest ones to forget. Yeah. All right. Take care, stay safe. And maybe we'll do a catch up in a month's time when hopefully the curve has been flattened. Exactly. Thanks a lot, Adam. Take care. Cheers, Zara. Bye. And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for fact, still my heart is saying, oh yeah. Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah. No longer focused on yesterday, and I don't care, the rest will say whatever they want, what's left to say, cause I'm leaving all the pain.